are those who dream of possibilities, of a world where access to quality, affordable healthcare is not mere wishful thinking, and there are those who strive to make that dream a reality. For the pastoralist communities in Turkana and Samburu counties, this quest is on the brink of victory. For 5 years, the USAID-funded Afya Timiza program has worked towards sustainably improving health outcomes for women, children, and adolescents from vulnerable communities in Turkana and Samburu. But how do you achieve this in areas with poor infrastructure, perennial drought, poverty, low literacy levels, and a deeply patriarchal society, in areas where tradition can easily trump any public health interventions?
For us to be able to address the last mile, where we are able to reach every community, we have to come up with very innovative approaches. Like in Samburu, we came up with a camel outreach, where we load outreaches and we do a circuit in those particular areas. And people camp there for about 2 weeks, immunizing children, providing maternal and child health services and family planning services. If you come to Turkana, we have innovative approaches like the Kimormor. Kimormor is a one-stop, it's like a Huduma center, where animal health, human health, and other social services like registration of births and deaths, national identity cards are issued in one center.
Turkana being a patriarchal society, almost close to everything that was to go wrong in Turkana went wrong. Turkana County before 2016 we were losing 1,594 mothers per 100,000 live births. Afya Timiza came in with this program of positive health outcomes to mothers, children and adolescents, and we have literally halved these maternal deaths. The same success story has been transmitted to infant mortality rate that has come down, and even to immunization, whereby right now as a county we recorded one of the positive indicators whereby fully immunized children in Turkana we are doing 82%, and we won a national award.
I'm one of those who have benefited from mentorship. They have mentored us on neonatal resuscitation, maternal resuscitation, all the emergencies which come to the mothers and to the baby.
Mamber Nicola ngarakan te tuwa bitarar ngao ngborol kunya pona. Amamber ni arange te ngarakan te tuwa ko tere iloto da tamaraya ngaropie. Toloto kudo talam ngaropie. Toloto kirakarti bere talam ngaropie. Lakin to na ja kita ngurakalu kirakaye bere mini kita maza kadina linda mama naka. Tamaze kondawa kadina linda mama naka.
In the very beginning, there was no resuscitator. If you go to the maternity, you will see 2 resuscitators. They brought us.
Na ngala bitar abu bacho do unia jokon ka do sister Veronica. Do unia jokon na armoria ko do net nya lemni orlo kainak kaloko ka ba knaka. Wa ka ba bunitoma. Kaina ko bacha patung borong lika ngarak dia apa ka bacha bunie kile na kwart na kolo ke bunyo kaina ba na ko pa kana ko la iya lawru.
The other innovations will look like to address cultural barriers is like the bathing cushions. Traditionally, the Samburu and the Turkana, they give birth in a squatting position, not lying on the back or a lithotomy position. So we came up with, we redesigned the bathing cushion, be able to enable them deliver while they're squatting.
In Samburu County, the community elders are the gatekeepers and also the custodians of the culture. By engaging them, we are creating ownership of the activities and the project, and also creating awareness to the community. Remember, they are the ones who make the decisions in the community. So if they tell them that these services are essential and they are needed, they actually now start promoting their good health-seeking behavior. So by engaging them, we ensure that there will be continuity even after the project ends.
Hakuna mkono ya Samburu sijaenda nawa kuelimisha watu, na watu wa Samburu walikubali. Ile vitu Afya Timiza ametusaidia na mambo ya mama na mtoto, na tumeshikana na wasee ya Wasamburu wote, tukakubaliana jukumu hiyo itakuwa ya msee.
Kaji nanu benebele na sotu nada ngurioni nada ngara tikita mari kwer na gili ni kesobat na kabudu sabana ngulela kwer na bar bubunu nanga baraba ile baraba ka do shorobo de na je gibas go bunu lo to na ngaya yo to ado yo na imani ga dawai ile abati ya bada buamba ta kwer ana bardu meduom barno molon to na digili ni kili
bisa mana ka ya na baik kai bisa mana ada tirna apa pun kasih na ka ni kai dia na ka ampa rabu age na ka hospital ni ka rabu na dana hospital ni na yi na silang kule dari hospital na icho.
We have actually seen our indicators improving. The skill delivery has improved from about 22% to now we are talking about 45% in 2019. The fourth ANC visit has also improved tremendously. From about 20%, we are talking about also about 44%. The family planning prevalence rate has also improved from a low of less than 20 to about 40%.
Nimesaidika, nimejua maneno ya family planning. Ukijifungua kama uko na uwezo unaenda hospitali, unasaidika hospitali, unapatiwa mawaidha juu ya family planning.
Hii nyekundu ni siku ya kwanza ya damu. Alafu unahesabu kuanzia hii nyekundu mpaka kwa hii ya black. Hizo siku mtu hawezi pata mimba, sawa? Lakini ukishamaliza ukiendelea kutoka kwa hii ya black kuendelea hizi siku zingine zote mpaka mahali nyeupe inaishia, hizo siku mtu anaweza pata nini? Mimba.
Mera runo atarbon mera tanaguman bon yana jadana wiyo darto una darun koni arwan ngejagi yogo yeruta nadagari alakara genge yerto mtunga nadagari.
Through support ya Afya Timiza ambaye walinitrain, ndiposa nikawa msichana ambaye nilikuwa role model kwa wasichana wengine. Niliweza kuwafunza wasichana wa binti shujaa ambao nilikuwa nawapata. Hao binti shujaa walikuwa pia wanapea habari wale wengine wao kwa wanapata habari. Na hivyo ndivyo hiyo habari ilienda mpaka sasa hiyo rate ya pregnancies katika kijiji chetu imerudi chini. Dijisomo ni redio ambayo imeundwa kwa lugha ya Kiturkana, imewekwa kwa lugha ya Kiturkana, na hiyo mafunzo yote iko mahali pale. Kwa hivyo ilikuwa iliturahisishia kazi sana. Ukipata kina mama wamesanyika mahali pale, unafungua tu wanasikiza.
Afya Timiza also decided to, after identifying that human resource was also a challenge, it employed 28 nurses for us.
It has built the capacity of leadership because they have done leadership management. Many of our managers have been trained on leadership management for us to be able to do supervisory skills.
When we are doing all this thing, we are focusing on USAID new programming approach, journey to self-reliance. We have tried all along to move that journey into creating a sustainable model that can be able to ensure that services are sustained beyond the life of Afya Timiza.
We have already made plans to ensure that whatever we have been doing together, because we have seen that it has worked, it has improved our health indicators, we will carry forward in terms of sustainability.
I am glad enough to report that as a county government and in tandem with the journey to self-reliance, we are absorbing these nurses us to ensure continuity of service.
For the other activities like Kimoromoro that they were supporting us, we have allocated funds in our budget for Kimoromoro to continue going on. And also for the others like capacity building, our ministry has also allocated resources. So I am sure that because we are all gearing to self-reliance, we have already made those things put in the pipeline, and it will not die off. It will remain there as a legacy that they left behind.
One of the lessons learned is on inclusivity. In programming, design of programming, you have to involve everybody. Sometimes we have ignored that we sit in a boardroom and design programs that don't involve the different stakeholders. So for you to be able to address them, you need to approach, to co-create with the communities, co-create with the people, the beneficiaries, co-create with other stakeholders.
What Afya Timiza has taught us at the long run is to ensure that healthcare follows the people, not the people following healthcare. And you must titrate a very acceptable, culturally sensitive healthcare system that is actually responsive to their needs.
I want to give my sincere appreciation to the USAID Kenya East Africa office for the support, the funding of the program, and the continuous technical support and guidance to the Afya Timiza program. I leave this program, or we come to close this program, proudly saying that it was one of the most successful programs to be implemented in a pastoralist community. We can proudly say that we have touched the lives of the most vulnerable.
It's no wonder they are called Afya, and Timiza they are wanatimiza.
Ndio. Afya yetu jukumu letu. Ndio. Afya yetu jukumu letu. Gesine kudungi choi kitumia. Anada gare kenge. Tasakunga kipina kasega. Anada gare kenge. Aronu ngeze akiyoko. Ayaruta nada gare.